I'm McKenna, and I'm in a group with Rachel and Sarah, and we did a topic, dermatitis, which is just the medical term for eczema. And we chose to do this condition because I had eczema when I was little. I don't really have flare-ups now, but does anyone else have it or has had it? Okay, so eczema is a chronic condition. It's inflamed, it's skin inflammation or irritation, and about 9 to 30% of the US population has it. It's associated with the immune system, and we know this because people who have it have elevated concentrations of immunoglobulin E, which is just an antibody that our bodies have like excess of when we overreact to allergens. And so because it deals with the immune system, having eczema weakens our skin barrier to irritants and allergens. And so risk factors are really anything that can weaken your immune system to allergens. So asthma's a big one. If you have asthma or someone in your family has asthma, just dry skin in general, genes can play a factor. They think there might be a genetic defect in epithelial cells that cause this barrier to break down. Certain beauty products can trigger this, triggers in the environment, frequent bathing or swimming, and young age is also a big one. So symptoms, it's often going to look like a rash or just extreme redness. There can be some bumps on the skin. There's skin thickening due to just how dry it is. And then itching is a big one. So with the picture that you see here, this one's a pretty severe example. So this person has a lot of scarring or scabbing. And so assessment, there's no blood tests or anything that need to be done. It's really just examination of the skin, and then examining the patient's medical history. So with that, they're going to check if anyone in your family has asthma, if you have asthma, if you've had any flare-ups before, and then also if the patient notices that their skin does flare up after eating a certain food, because that could rule out that this is just an allergy to a certain food and not eczema. And then these pictures just show the difference in severity of this condition. So on the left, it's just, his skin is just red and splotchy, and then the one on the right, that kid actually has the scabbing on his ankles and the back of his knees. So that's more common in younger kids. So for treatment, there is no cure for eczema. It's just a lifelong condition, but it does get better with age. So really, treatment is just managing the symptoms and then preventing new flare-ups. So especially as nurses, we work with patients on how to prevent these future flare-ups. So that's encouraging the patients to take showers after excessive sweating, wearing lighter clothes, bathing less frequently or just taking shorter showers, moisturizing often, using high quality lotions, and even washing clothes in a milder detergent can help. And then just lessening the symptoms of it, we can use topical steroids, so that's hydrocortisone, and then just antihistamines can help reduce the inflammation. And then anti-itch cream can be helpful too, since it can be kind of painful. And then some kind of psychotherapy may be needed. I actually was just talking to someone here the other day about this presentation, and their cousin has it. She's made fun of in elementary school because of it. So that was really heartbreaking to hear. So that was just some of our patients could really just struggle with this. So prognosis and follow-up is really good. Half of the children who get it outgrow it. But yeah, flare-ups could still happen. But a patient really doesn't need to come back in for any kind of follow-up appointment unless the flare-ups can cause some kind of inflammation, so they might need to come in for just antibiotics for that, or if just their home remedies are not working, they might need to come in.